Viral load and monitoring. Viral load refers to the amount of HIV in your blood. Knowing your viral load can help your doctor to monitor your HIV disease, decide when to start treatment, and determine whether or not your HIV medications are working. In general, having a low viral load decreases the risk that you will pass HIV to someone else through sexual contact. But it is important to remember that having a low viral load does not guarantee that you won't give it to someone else, and appropriate precautions should always be taken. The largest reservoir of the virus hides in the lymphatic tissues of the gut. Clinicians are not able to access this reservoir, so blood is drawn from a vein in your arm in order to measure viral load. Your doctor will likely order a viral load test at your first visit after you are diagnosed to establish a baseline level. After that, the doctor may have your viral load tested every 3 to 6 months to monitor your disease and before and after you start or change therapies. HIV is too small to see through a normal microscope, so viral load must be determined in different ways. One way that doctors can measure your viral load is by using a technique called PCR. PCR produces more copies of the HIV genetic material in the blood sample so that it can be detected and counted. First, the HIV genetic material known as RNA, which is in your blood sample, is extracted and put into a machine that makes copies of the viral genetic material. Once enough copies have been produced, a doctor is able to determine the viral load in your blood sample. HIV viral load results are provided as the number of HIV copies per milliliter of blood. If the measurement is high, anywhere between 5,000 to 10,000 copies per milliliter, the HIV is reproducing, and it is likely that the disease will progress faster than if the viral load is low. A low viral load, anywhere between 40 to 500 copies per milliliter, indicates that the virus is not actively reproducing, and disease progression is unlikely at that time. When a viral load is classified as undetectable, it means that HIV is not present at high enough levels in the blood to be detected with the test, although the virus remains in different body tissues. Your viral load can change over time. People who are not infected with HIV have no viral load. When a person is first infected, viral load will be extremely high, quickly peaking to greater than 100,000 copies of HIV per milliliter of blood. Between 3 to 6 months after being infected, the viral load typically decreases and levels off. Some people who are not taking medications may have a very low viral load at this point, but most have a relatively high viral load. Over time, the viral load in your body increases, and the virus destroys more and more CD4 cells, which are an important part of the immune system. Once the CD4 count indicates major damage to your immune system, treatment is often necessary. While the viral load typically increases over time, treatment can lower the viral load and thereby slow the progression to AIDS and improve the prognosis. Viral load tests can help doctors to determine whether your treatment is working to control your HIV. When beginning therapy, a reduction in viral load indicates that the treatment is effective, while an increase in viral load may indicate that the treatment is not working, that you are not taking the medications as directed, or that the HIV in your body has become resistant to the medicines that you are taking and they stop working. Effective treatment should reduce the viral load within 3 to 6 months after beginning treatment. The main goal of therapy is to reduce the viral load to undetectable levels.